Hello, hello. Welcome back to the Fertility Confidence Podcast. Today I have an interview with Dr. Mark Ratner. He's the Chief Science Officer of Therologix, a very, very popular supplement company that you may or may not have already heard of. And prior to joining Therologix, he has over 30 years of focused male fertility practice as a urologist. So I was really excited. We're going to have him back to pick his brain a little bit more about male fertility, because today we focused on a very popular topic and we started chatting about GLP-1 medications and their current widespread use in the population. What does that mean for fertility? What does the safety data look like? And that actually took us in a really important conversation around safety with supplements and what to look for when we're purchasing products to put in our body to make sure that they are safe and they are what they say they are. And Dr. Ratner shared some really interesting research looking at some products that actually didn't have even remotely close to the dose on the label. So I felt like I learned a lot in terms of how to guide my clients towards brands and what to look for when purchasing supplements. We chatted about the GLP-1, craze, but also how can we support our bodies in similar ways with other things that might be safer, that other things that have research. He and Therologix as a whole are very focused on the PCOS population. And so a lot of experience in that realm. And we chatted about that. Hopefully you guys get a little bit of understanding around how to buy supplements, around the importance of supporting your body through nutrition and lifestyle, especially if you've been considering GLP-1 medications or currently taking GLP-1 medications, and other ways in which we can support your body through that process. So enjoy, and I will see you guys in the next video. Welcome, Mark. Thank you for joining me on the Fertility Confidence Podcast.
Thanks for having me, Kelsey.
I feel like people have been asking me for an episode about this topic for a really long time. But before we dig into it, why don't you share a little bit about you?
Sure. So I like to say I'm a recovering urologist. Uh, I was in practice for about 32, 33 years, seeing patients and mostly working in male fertility in the Washington, D.C. area. I'm also the chief science officer for a company called Therologix. And we are a supplement company that has a pretty big presence in the fertility world. We've been working with some of the major IVF networks here in the States and even some Canadian practices as well for probably 12 or 13 years. So we have a big interest and a pretty interesting product line for both men and women.
Mm-hmm, mm-hmm. Now that I know that you're a recovering urologist, I feel like we'll have to have you back for a whole slew. I have all these other questions now.
Okay.
I have a deep fascination with male fertility, and just like the overall kind of lack of male fertility care I feel in this space right now. So I love that that's part of your story. I think it's so important. Okay, let's talk Ozempic babies, because this is something that is all over the media. It's all over social media. I'm getting asked this question in my community weekly. I know I'm not the only one experiencing, like, what is this? Is it true? Should I try it? I'd love to talk more about what a GLP-1 medication actually is, first
Yeah.
and foremost.
Let me start with a small disclaimer
Mm-hmm.
because I've never prescribed a GLP-1, and so I don't have much direct knowledge about the drugs themselves. Being a supplement company, the way that we sort of backed into the GLP-1 space was
Mm-hmm.
through Berberine,
Mm-hmm.
okay, which is a supplement. It's actually extracted from several different types of plants. I think the most common one is barberry. Um, And the reason that we became very interested in berberine was because we are very active in the PCOS community. Um, and as you probably are aware, a very high percentage of women with PCOS have something called insulin resistance. And insulin resistance is an underlying condition which is the cause of type 2 diabetes. It's the cause of gestational diabetes, meaning diabetes of pregnancy. And insulin resistance in PCOS leads to higher blood levels of insulin in those women. And the high levels of insulin in the blood stimulate the ovaries to produce testosterone. This is why women with PCOS have hair and skin issues because of the effects of excess testosterone. And so if you want to reduce their testosterone levels, since it's the excess insulin that's causing that elevation of testosterone, to get at the root cause, what you want to do is reduce the insulin levels in their blood, and you do that by reducing what we call insulin resistance. In insulin resistance, what's happening is our cells are not as sensitive to insulin. They don't respond to insulin like they should. And so the pancreas senses that. Pancreas is what makes insulin, right? It senses the fact that the blood sugar levels are getting a little too high because insulin's not working at the cellular level. And so it releases more insulin. It says, oh, we need more insulin. And so insulin blood levels go up, creates more testosterone in the ovary. This leads to absent ovulation. It leads to acne. It leads to excess facial hair or body hair. It can lead to excess weight, all of the typical things that we see in PCOS. So about 10 years ago, we actually pioneered the first Inositol supplement in the States for PCOS patients. And that's been hugely successful, but over the last, say, 5 to 6 years, there's been a really growing interest in berberine. Mm-hmm. And then what happened was, and I'll explain why berberine relates here, but about a year ago, a very clever marketing person decided that they would call berberine nature's Ozempic.
Mm-hmm. And because of course, why not capitalize on the buzzword, right?
everybody quickly was becoming aware of the fact that Ozempic and Wegovy and Mounjaro, these are what we call the GLP-1 agonist drugs. These were hugely successful in weight loss, controlling diabetes, type 2 diabetes, improving what we call insulin sensitivity. Mm-hmm. If you can improve insulin sensitivity, that's sort of the same thing as saying you're reducing insulin resistance, okay? And these drugs do a terrific job of doing that. So the question then is, since these are the GLP-1 drugs, what's GLP-1? Okay, so GLP-1, it stands for glucagon-like protein 1, okay? It's a hormone. It's a hormone that our body makes, and we make it in our intestines, in the small intestines, and it's usually released from the small intestines after a meal, okay? In many different places in our body, we have receptors for that hormone. They're present in the gut, they're present in the brain, they're present in the heart, they're present in the kidneys, okay? And so what happens is the hormone gets released, it binds to these receptors throughout the body, and it has some pretty amazing effects. It makes you, GLP-1 will make you feel full. In other words, it increases what we call satiety. It will slow down stomach emptying. So your stomach doesn't move the food along as quickly. And so you stay full, feeling longer. It actually works at the heart level, okay? It works in the brain, and actually that feeling of fullness is also not only in the stomach, it's also in your brain, okay? This is the natural hormone that our body makes to accomplish a whole bunch of different things. Berberine, the way it works is in part is it increases the body's natural release of GLP-1. Okay. Now, there's a big difference, and this is why calling it nature's Ozempic is very misleading. Big difference between the natural hormone and the drugs.
Right.
The way they made these drugs is they looked at the molecular structure of the GLP-1 hormone, and they said, maybe if we tweak that structure, if we change it a little bit, we can make the drug bind to the receptor, the GLP-1 receptor, and stay there longer. And in fact, that's what they did. And so the normal GLP-1 hormone, the one that our body makes, it has what we call a half-life, meaning how long it takes to disappear from our system, of minutes. It's gone very quickly. The GLP-1 drugs, they have a half-life of days. That's why if you're taking Ozempic or Mounjaro or Wegovy, any of those, you take the shot once a week, right? Because it sticks around that long. So what will Berberine do? And have there been studies with the GLP-1 drugs in women with fertility issues? The answer is those studies there's more studies with Berberine because it's been around a long time.
Yeah.
Not so many studies yet with the GLP-1 drugs. And it appears to be safe, but I think until there's a little bit more data, you'd probably want to be cautious about staying on those drugs through a pregnancy.
Right.
Even Berberine it crosses the placenta. So what that means is, if you get pregnant and you continue to take Berberine, the baby is getting Berberine.
Exposed, yeah.
Yeah. And there are a couple of studies where they've kept women on the Berberine throughout a pregnancy, especially in PCOS patients. Compared to placebo, it was really significantly improving pregnancy rates in PCOS, women with PCOS. And relatively small studies, maybe a few dozen patients. So the fact that there were no major congenital anomalies or birth defects, that's great. But until you really look at hundreds and hundreds, maybe even thousands of patients, I don't think you can be too confident or too sure of yourself. Yeah.
Yeah. I'm glad you brought this up because this is something we use quite a bit in practice with Berberine specifically, but I'm always counseling people like we just don't, and this is true for all herbs, like we just don't have the safety data in pregnancy. It's unethical for us to run studies, not me, but like others to run studies in pregnant women. And so we have to be a little bit extra cautious. So how do we continue to support your blood sugar regulation through pregnancy if you were using Berberine to help you get to that point?
Well, even Metformin, the drug that has been prescribed to women with PCOS to help control blood sugar and lower insulin levels for probably maybe 50 years, a long time, is this drug called Metformin. Okay. It's not an easy drug for a lot of people to take. It has a pretty significant GI, stomach side effects. It's something, some studies say 20-25% of people who start on it can't continue. They just give up with it because of the side effects. But interestingly, it's what the FDA here in the States calls a class B drug. In other words, a category B in terms of safety during pregnancy. The FDA has sort of three categories, A, B, and C. C means this is really dangerous. We know it's dangerous. You got to stop this, during pregnancy. A means this is fine. We know it's completely fine and safe during pregnancy. Things like amoxicillin, I mean, drugs that have been around for a long time and have a really good safety record. But there's a huge number of drugs that they call category B, which essentially means we're not sure.
Yeah.
Okay. And that's where metformin is. Okay. Now, plenty of women that have taken metformin, women with PCOS, that have stayed on metformin through their pregnancy. But the official word is, probably better to stop it because we can't be certain. So, if berberine crosses the placenta and we're not certain of its safety, and metformin, we're probably looking at the inositols as being a really great option for women with PCOS who then get pregnant, to stay on it. I mean, if it helps you get pregnant, which it will, great. You don't stop it. Stay on it through pregnancy. There's now 6 or 7 studies that have been published looking at whether or not inositol supplementation will reduce the risk of gestational diabetes, diabetes in pregnancy. And women with PCOS, their risk is about, I think it's like 300% higher to get gestational diabetes. And if you stay on inositols through your pregnancy, it cuts that risk in half. It drops it by 50%. It also reduces the risk of preterm labor, premature birth. So inositols are totally safe through pregnancy. And in fact, if a woman has PCOS, they're a terrific idea to stay on it. Getting back to the GLP-1 drugs, those studies will get done.
Yeah.
Because there's, not to be too cynical about it, but there's plenty of money.
No, that's allowed to be said here. Don't worry.
They're happy to fund these studies.
Yeah.
Part of the problem in the supplement world is you really, there aren't the same kind of patent protections in the supplement world. You cannot patent a natural substance. Something like berberine, which occurs naturally in nature.
Right.
There's no patent on berberine, which is why, if you go to Amazon, there's literally about 50 or 60 different berberine products for sale, which raises another interesting question. Are any of them good?
Safe. Yeah, safe. And are they what they say they are?
Right. How do you tell whether you're getting what you think you're getting? There was actually a study that was published, I think it was 2018. Out of the University of Kansas. They bought 15 different berberine products and sent them out to an independent lab for testing. And I think it was 5 of the 15, a third of them contained less than 60% of what they claimed on their label.
Oh.
That was 6-7 years ago. Now there was another study that was an industry-sponsored study published last year. They bought 33 different products, either on Amazon or Walmart, online. Mm-hmm. And again, had them independently tested. And of the 33, there's something like 6 or 7 of them had no berberine at all.
Oh my goodness. It's one thing to worry about what you're taking, but then to have to worry if what you're taking is actually what it says on the label is like a whole nother ball game.
Right. Yeah, no, I mean, so there's a lot of bad actors in the supplement world. Yeah. Canada, I will tell you, Canada has far better controls than the FDA does here in the States.
Yeah.
Generally speaking, the natural products labeling laws in Canada are really good, and they keep bad actors, from selling products that don't really measure up. In the States, there are 2 programs that are nonprofit third-party certification programs. So companies that make a supplement or supplements can submit their products to these programs for certification. And if you don't have at least 90% of the content claim and you have to be obviously free of any kind of adulteration or
Right.
contaminants. But if you're 90 to 110%, they give you like 10% up or down from what you're claiming on the label. You can get certified. The two programs are USP, which stands for U.S. Pharmacopoeia, and then NSF. NSF is in Ann Arbor, Michigan, and they're both nonprofit programs. Um, if you go to buy a supplement, you want to see either the NSF logo or the USP logo. Um,
Does it
and
have to be on the bottle in the States, or does it just have to be on their website?
it usually will be on the bottle.
Okay.
Yeah, no, it should be on the label. Exactly.
That's good to know.
Yeah,
Is
that's
there
one of the.
anything else people should be looking for to feel trusted with their purchases?
It's a good question. I mean, look, our company started 22 years ago. Um, all of our products, every single one of our products, goes through NSF certification and maintains its NSF certification. Um, One of the things that some companies will try to do, if they're putting together herbal blends, okay,
Mm-hmm.
they will mix together. I'm going to just make something up, a little bit of ginger
Yep.
and a little bit of this and a little bit of that. And then they call it a proprietary blend. Okay.
Yep.
Sort of like
My
this.
listeners are going to laugh because I talk about how much I don't like this all the time.
Yeah, yeah, yeah. I mean, it's like their secret sauce.
Yeah.
Okay. But in the industry, what we know is this is sort of a loophole that allows you
Mm-hmm.
not to disclose how much of these things you're actually putting in there. Um, and then you can file a patent, and usually it's just patent pending, because most of the time the patent agency won't actually grant a patent,
Mm.
because what you're claiming is this special mixture of ingredients, the way that we're combining them, we want a patent on that.
Right.
So it's sort of it's a as you were saying, it's a sketchy uh, aspect
Yeah.
of, of of the supplement industry, at least here in the States.
Yeah.
And
It's
again, I
hard as
think
a practitioner because if someone comes in to work with me and they're taking some things and I'm like, well, these are, good ingredients based on the research, but because it's a proprietary blend, we have no idea how much of this you're actually getting. And if we're going to be evidence-based and we're going to follow the literature, like we're probably not actually getting those correct dosages because they're hoping all of the herbs will just work together to do the right thing. And I think
right. Yeah, no,
I think it's a bit predatory, honestly, like in the not just in the fertility realm, but in the supplement space in general, to just assume that this is going to work when in reality, like it's not following the correct research dosages.
yeah. Well, they hide. It's a way that the companies can hide how much you're getting of it. It
Right.
feels like, oh, our product contains, now at least the labeling laws
Right.
by the FDA here in the States, the labeling laws require that nutrients that have what's called an RDA or a daily value established, you must disclose exactly how much
Hmm.
of each of those nutrients you're providing. But there's plenty of stuff that goes into supplements for which there is no
Right.
daily value or RDA, and stuff like CoQ10 and some of these things are really excellent supplements. Okay,
Yeah.
but some of them are also quite expensive to put in,
Mm-hmm.
and so if you throw the CoQ10 into a proprietary blend, you'll see these companies say our product contains CoQ10, but they don't even disclose how much.
Yeah.
So yeah, you're right. It's predatory, and it requires an educated consumer.
Yeah. Yeah. Supplement world is a scary place. There's a lot out there. There's a lot of great things out there, but it's about kind of weeding through. And I'm so happy you brought up the two different places to look for a good, proper assessment so that people know what they're buying is actually being properly packaged and sold to them based on what the label claims. Because I'm sure there's far too many of us taking things that we think are good for our fertility, but we're actually not really getting the true benefit from that.
Yeah, no, I mean, it's definitely buyer beware. And I will say, though, that a product that has an NPN and natural products number
Hmm.
in Canada, you can have a lot more faith in that product than you can with something that is made in the States and is sold on Amazon, because it's just way less regulated and here in the States. And that's, that allows a lot of bad actors to get involved. Yeah, I mean, look, the fertility space is one that has some really effective uh, supplement options,
Yep.
um, and especially for things like PCOS or egg quality issues. Um, there are some very good options, and the studies have been slowly getting done. It's challenging to do fertility studies
Hmm.
with supplements, though. Um, Part of the reason is because, number one, it's hard to get funding. Again, because you can't get patent protection on most of these products. But the other reason is because if you want to do a placebo-controlled study where half the people get, placebo, sugar pill, and
Yep.
then the other half get, let's say, CoQ10, and
Yep.
you want to see whether or not egg quality improves, you've got to give the people coming into the study as subjects, you've got to give them what's called informed consent. They have to sign a consent form. And on that informed consent, it's got to say, you've got a 50-50 chance maybe that you're going to get placebo.
Yeah.
And the intervention, the CoQ10, is actually an over the counter product that you can buy down the street, okay, or online. So I can tell you, I worked with fertility couples for many, many years. Everybody who comes in to be seen, they want to be pregnant yesterday.
Yeah. 100%.
Okay?
They
I
don't
mean,
want the placebo.
no way do they want placebo. Right, exactly. It's like, wait, I can buy this down the street and you think it might help my egg quality? It's like,
Yeah.
thanks anyway. Okay.
Yeah.
And even something
Sure, I'll
as,
sign up, but I'm also going to hit the store on the way home just to be safe.
well, that's so interesting that you say that, because in the supplement world, we call that drop-ins. Okay. We say, okay, there are probably people who sign up for the study, and because they know there's a chance they're going to be getting placebo, they go out and they buy the stuff themselves. And so even something as basic as vitamin D,
Yeah.
very hard to do well controlled prospective studies, because it's just hard to enroll people.
Yeah.
It's very understandable.
Yeah. I have to explain this to clients a lot of times of like, this is the research we have available to us. And a lot of it is just these couples did IVF and this is how they're similar and this is what they took and this is what happened. And it's kind of the best that we have to offer with, especially with supplements, like you said, because big pharma is not coming in and, spending their money
Right.
there,
Right.
unfortunately.
Yeah, it's a lack of funding, and typically what happens is, when something gets enough momentum, a
Hmm.
particular supplement, let's say, here in the States, the NIH might get involved. Okay,
Right.
it's funny because 10 years ago, when we launched basically the first inositols product here in the States, um, we had really been watching the literature, the published science, which was mostly coming out of Europe.
Hmm.
And probably 80% of it was coming out of Italy. And most of the doctors here in the States and in Canada as well, they don't read European journals.
Right.
They might get the major US fertility journal, but there's lots of other journals being published all over the world. And so they weren't really following the literature about inositols
Is
and
that why
PCOS.
we're always behind?
So
Maybe.
we we launched this product 10 years ago, and we would go in and do meetings and give speeches at meetings, fertility conferences about inositols, and it was sort of like people were just, they had this sort of blank look on their face, and we started to call it NIH syndrome, which stood for not invented here. Okay,
That's
so
funny.
it was, we were really pushing a rock up a hill. I mean,
Yeah.
it was hard to get them to pay attention. But we kept at it. And, And I'll tell you the other thing that's incredible is that the PCOS community that has really flourished over the last 8, 9, 10 years here in the States, and I think Canada as well. There's an advocacy movement that
Yeah.
has taken root because organized medicine, um, to be frank, is not doing the best
Yeah.
job of treating women with PCOS.
Mhm.
It requires a multidisciplinary approach. It requires sort of a holistic attitude towards the patient, and that's not, these days with corporate medicine here, it's not really their strength.
Yeah.
So those things have together, the advocacy, and finally paying attention to world literature. Um, we've seen a lot of increased interest, and it's finally the NIH has finally caught on as well. So the NIH is now funding the studies underway at Penn State Medical Center. The first inositol study in the United States with PCOS women is finally being
Sweet.
funded by the NIH. Yeah.
Finally now in 2024.
Yeah. Right. 25 years after the published literature started. Yeah, exactly.
I
So,
love the not invented here because it's so true. Whenever anytime there's something that I'm like, we're hearing it, over there, and the US is like, I'm starting to hear clinics talking about it like ever so slowly. And then there's Canada where we're just like, not yet. Like it just takes a little bit longer
yeah.
for the more progressive thinking to get filtered into our clinics over here, unfortunately.
Yeah. Absolutely the case.
Okay, let's circle back to the beginning real quick for our PCOS friends that are listening that heard all the wonderful things berberine can potentially do for their body. With our PCOS population, is there women in there where berberine maybe isn't the right step for? Like how do they know if they should be advocating for berberine in their care plan?
It's a difficult question to answer. And part of the reason is because PCOS, not every woman with PCOS looks alike.
Mm-hmm.
Okay. Um, and the interesting thing about PCOS is that even the healthcare providers who are supposed to be the experts on PCOS, if you put 100 of them in a room and ask them to tell us how you make the diagnosis of PCOS, it's like fist fights will break out. I mean,
Right.
okay, because there's several different criteria that there's NIH criteria. There's what's called the Rotterdam criteria. There's the Androgen Excess Society's criteria. Okay, and so some women with PCOS have signs of testosterone excess. The hair, skin, weight. Okay, some don't.
Mhm.
80% of women with PCOS have high BMI. They're overweight. Okay, but maybe 20 or 30% even have what we call lean PCOS.
Mhm.
They have normal body weight or they're thin. How is that? Well,
Right.
nobody really knows for sure. So I would say, and then the other obvious main issue with PCOS is, either absent or irregular periods. If you stop ovulating, that's why you can't get pregnant, right? I
Right.
mean, you don't know when you're going to ovulate. You don't know how to time intercourse. So the answer to your question is, I think since berberine's primary benefit in at least acutely, at least in the short term, the primary benefit is that it improves insulin sensitivity. And there's now some studies showing that you can combine it with inositols and you get an even
Mm.
better sort of 2-for-1 synergy, because they work in different ways, but they accomplish the same end. So a woman who has signs of excess testosterone or knows that her blood sugar is a bit out of control, her what we call HbA1c is elevated. Okay,
Mhm.
those are women who are probably really good candidates for berberine and inositols. Okay, insulin sensitizers.
Right.
Okay, a woman who is thin has no signs of androgen excess, but is not getting her period except maybe 2 or 3 times a year. And then they do an ultrasound and they see cysts on her ovaries. So the doctor says, "You've got polycystic ovary." Okay. Um, because she doesn't really have the signs of androgen excess. Maybe not. Maybe the inositol insulin sensitizers are not going to be the right step for her.
Right. And so that person would maybe just want to be digging a little bit deeper into why we aren't ovulating before
Yeah.
jumping
Well,
to
I mean,
certain supplements.
so the whole concept of lean PCOS, there's a it's funny. There's a movement which periodically kind of you hear from that says we should rename this condition, okay?
Mm-hmm. Mm-hmm.
Because it really is a misnomer, okay? Polycystic ovary, on ultrasound, if you look at the ovaries on ultrasound and you see lots and lots of cysts, that's one of the signs. But it's not always the case.
Right.
Some women have all the other signs, but their ovaries are normal, okay? And so there's always a group at these meetings that says, we want to talk about renaming this. And then everybody shouts them down.
I
It's hard.
remember this a few years ago being a big hot topic.
Yeah, it's hard enough for us to get attention for this condition and the kind of research dollars that it needs. I mean, it's 8 to 10% of all women,
Yeah.
right? And it's not like something that goes away.
Yeah.
It's with you for a lifetime, and it leads to metabolic syndrome and increased cardiovascular risk. And so it's definitely something that is underserved currently. And so they're worried, especially the PCOS challenge people. It's like, oh, no, don't take the name away. We're just getting the kind of traction that
Right.
we need.
Yeah, that's so true. That's a good point. Mark, this was such an insightful conversation. I feel like we learned so much, not just about berberine, but about supplement safety, which I think in our world is such an important conversation to have. How can our listeners find out more about you and about Therologix?
So our website's just therologix.com, THERALOGIX.com. And I think it's a pretty good website because we have a lot of sort of foundational information there. We have a lot of clinical trial references that are there. People want to really dig in. And if you go to the website, you'll see we have 3 full-time registered dietitians here at the company. And so people who have questions about our products or about something that they heard from their healthcare provider, and they want to know whether our products relate to that, they can feel free to call us, and they'll get one of our dietitians on the phone.
Amazing.
9 to 5 Eastern time. Friday.
Don't call on Sunday. No. What is one piece of fertility advice you'd love to leave for our listeners?
Wow. Boy. Keep trying. I don't know.
Yeah.
It's,
You're not the first person to say that, so that's valid. That's a valid piece of advice.
It's so interesting because it's a even though I was a urologist and I ended up treating male factor, in other words, I sort of handle the male end of things.
Mm-hmm.
It's it's a couple's issue. It's not there's takes 2, sperm and egg, and so invariably I learned everything I sort of needed to know about female fertility as well. I guess I would say don't wait too long. I mean, if there was one piece of advice, and these days egg freezing has become real popular. For women who, for whatever reason, have delayed, getting pregnant. But there are also steps that you can take to kind of preserve your fertility. Natural things you can do, lifestyle things you can do, kind of to keep your supply of eggs healthy longer. Yeah. And there's all kinds of interesting stuff coming too. I mean, we can talk about things like NAD. You familiar?
Yes. Keeping my finger on that as well as people keep bringing that to me too.
That's really interesting stuff. but again, waiting for some good human trials. Uh, but so, yeah, I would say don't delay too long. That's my best advice.
Yeah, I love that. Get support early. You don't have to wait
Right.
till you have a problem to get help. I think that that's very sound advice.
Yep.
Thank you so much, Mark, and hopefully we
Thanks.
can chat again.
Absolutely. Thanks for having me.